We work towards a world where, and then you can see some of the things that we are working towards in terms of our programming, in terms of our research and advocacy work. And some of our services include virtual peer educators, virtual peer support groups, because we know there's a level of anonymity that people who are maybe struggling with some of these concerns would like. And so we have our resources mostly through this virtual space. We also create a number of resources around barriers to disclosure, healthy relationships, and videos around sexual health and sexual well-being. And then we also do lots of different trainings on campus, in the community, and in masjids. And so that's just a little bit about us. In terms of our values and our programming, we really sort of center the lived experience and the identities of the individuals that we work with, and so that's sort of what it's in the middle, and it's student and survivor led. So what survivors need is sort of where we go and how we advocate for their needs. It's also sort of one of our values too is shared leadership and collaboration. So what that means is that we are working with survivors on creating allowing for their agency in whatever spaces that they're in, and we're healing centered. So what that means is that sometimes healing can look really different for lots of different people, and acknowledging sort of the idiosyncrasy of that. So now Yasmeen will talk to you a little bit about what CURL is and how we work together.
Assalamu alaikum. Thank you for having me. So CURL is a Center for Urban Research and Learning at Loyola University Chicago. It's a community-based research center. So all of we're based on a collaborative model. So that means that CURL staff, Loyola students and faculty, and a lot of the organizations that we are partnered with are all doing the research together, as opposed to academia doing the research for themselves and for publication. And our collaboration with HEART is very much based in that model, and that we have been collaborated with HEART since 2011 and have done multiple research projects and evaluations of some of their work, including what we'll be sharing with you shortly. I do want to say that our research team did not just include me, it included another grad fellow, Monica Reina, and was supervised by Gina Spitz, who is also on the staff at CURL and is a research professor.
So now we're just going to give you a brief introduction around this work if you're not already aware. So 1 in 5 women are victims of or survivors of sexual violence in colleges, and more than 90% of those individuals do not often choose to report. And we know that this literature around barriers to reporting exists in a lot of POC spaces, including Muslim spaces, and some of those sort of shared barriers include shame, self-doubt, sort of knowing and loving and maybe even fearing the perpetrator, and the fear of not being believed, right? So when something happens and there's an element of power, there's an element of like, I can't believe that this person would do that, or that you're accusing someone to do that, there's a lot of fear and a lot that can prevent individuals from coming forward. We know that our religious leadership and our community are not always trained to address these issues, and that in our research result, we've also found that spirituality or sort of religiosity can play a dual role. Sometimes it is a very important mechanism of coping with the ongoing violence of being, I think, a Muslim woman in society today, as well as contributing to some of the barriers around shame and silence in coming forward. And so the work that we do at HEART is really rooted in this tradition of concepts of justice and commitment to serving the community, as well as the concept of rahma, so compassion and sort of holding space for whoever comes forward and whatever sort of trauma that they're bringing to us. So now I'll just give you a brief history of this project. And so this project is, we're going to be referring to it as Reliance. And so this was a grant that was given to us after, or we applied for this grant after, I guess I'll do some storytelling. So we have staff members in DC, in the Midwest, and then in California. And after one of our staff members did a sexual assault awareness workshop, so we have one of these trainings like Sexual Violence 101, Healthy Relationships 101, and so she had done sexual violence training at the MSA West conference. So there was multiple schools that came to do, do MSA things and have a conference. And so she spoke at that. And after her presentation, there were a number of disclosures that happened. And so a number of individuals were making sense of things. They had now the language to see what was going on and what they were seeing in their own MSAs. And so this trainer, Sarah, was called in to be a consultant, basically. And so one of the issues that she sort of had navigated was around how to train sort of the secular spaces and on college campuses to be more victim-centric for missing survivors. Also, how do you navigate when there's an alleged perpetrator in the MSA space and it's not a safe space for a number of people. And so after all of these different sorts of things were coming out, we realized that maybe there is a larger need here, and that is why we applied for this grant around Alliance to do training specific to college campuses, because that is where we saw the need, and that is where sort of all the disclosures started to come out. And so some of the goals of the program were to train the leaders via a trainers sort of model. And so this model has been talked about in other sort of panels over this weekend. And so what a train the trainer model is that Heart staff had individuals come who were interested in becoming trainers. We developed the programming, we taught the curriculum to them, and then they were responsible to put on their own sort of like sexual violence 101 or like support survivors in their own community. And so we're sort of empowering the community and the campus to do that work. So that's a part of the awareness raising of the goals of the program, and then there was also the research and evaluation of what are people learning and how do we measure how people's beliefs, attitudes, awareness around these issues are changing after this like culturally tailored programming. And so that's obviously where Yasmeen comes in. And then there's just some details around like what we sort of offered. We offered the 2-hour sexual violence workshop, we offered the student leaders a training, we offered webinars, and then they were required to do 2 additional programming. And that was the ideal, and we will talk about what actually happened, as sometimes engaging with this work can be very difficult. So methods, right? Okay, so I talked a little bit about this, but thank you. So basically, we had recruited 6 different campuses. 3 of them agreed to sign on for the full year commitment, and then only 2 committed, not only, but 2 committed to the full year. And the way that we collected data was in 3 stages. So we had a pre-train the trainers, and then a post-train the trainers to see where the trainers were in terms of their own knowledge around these issues. Then we had a post-workshop. So remember I told you the trainers were responsible for doing their own workshop in their community. So after that workshop, we had a survey that was constructed for the individuals that participated, thank you. And then we had a 6-month follow-up. So really, this was focused on what does sustainability look like, what are some of the hard programming issues that maybe came up that we can be better at, because this was a way for us also to evaluate what does our programming look like and where are some of the gaps. And so the way that the surveys and the questions were constructed were in collaboration with Pearl, and again, just reviewing sort of campus climate, program feedback, and what sort of got in the way of making change on campus. So now Yasmeen, because she was our evaluator, is going to talk a little bit about results.
All right, so I'm going to go through, there were a lot of results that came out of this, 3 reports actually, but I will try to summarize them in the best way possible. The research done with the workshop specifically were separated by gender, race and ethnicity, and religion. So anytime that's brought up within this data, gender was referred to as only men, race and ethnicity broke down into Arab, Middle Easterners, Asian, South Asian as the most common, and religion was broadly divided by Muslim and non-Muslim. And that was because of how, just the population that we were interacting with. So in terms of the workshop data, results were divided between awareness of campus sexual violence, post-workshop knowledge, and beliefs regarding sexual assaults. So overall, 56% of students reported knowing 1 or more fellow students, including themselves, who have experienced some form of sexual violence, and 82% experienced some form of sexual harassment while on their campuses. So as visually represented in some of these graphs. Women and non-Muslim students reported higher levels of knowledge about sexual violence issues affecting students on their campuses overall, as well as higher knowledge in terms of resources available for survivors on their campuses, and compared to men and Muslim students. It's worth noting that these results are not meant to show that these different groups do not experience sexual violence or harassment, but that underreporting is still a huge concern and barrier to disclosure impacts how frequently survivors report, and thus how many people are still unsupported as a result or after an traumatic experience. So students were also assessed on their knowledge of sexual violence issues and resources, including, as well as their familiarity with terms including rape culture, victim blaming, sexual assault, male privilege, consent, and the Rahman principles. So overall, 51% of participants reported being very or extremely knowledgeable about sexual violence issues, and 59% regarding the resources available to survivors. Unsurprisingly, women were more likely to be familiar with these terms, as you can see in the chart here. I just wanted to point out the male privilege data point, where only 12.9% of men were not familiar at all with the term male privilege. And you will see across the data that I'm presenting later on that there are huge, drastic gender differences, especially in how involved, knowledgeable, or willing men are to have these discussions regarding sexual violence. And while the differences across race and ethnicity were not very different, it's worth noting that Arab, Middle Easterners had higher levels of knowledge regarding these issues, as well as non-Muslims tended to report higher levels of knowledge. So then we also asked participants to agree or disagree with the following sexual assault beliefs. And while the majority of students disagreed to some level, women and non-Muslims were the most significant. And I will look at these first two of those statements. A woman who has experienced sexual assault is less desirable as a partner. 94% of women strongly disagree, where only 64% of men do disagree with these statements. And there's a huge variability across the spectrum. And you'll see that across all four, there's huge discrepancies between gender in terms of who strongly disagrees. So it's worth noting on there. So going on to the trainings, I'm just going to briefly go over this, but there were four main categories that students were assessed on in terms of supporting survivors, responding to survivors, helping survivors access resources, and helping them decide whether or not to report to authorities. This is just a chart of the top 5 reasons that students thought survivors were not going to report, and it's worth noting that these were the 5 before and after training that were the same. Going on to the interview, so there's a 6 months after HEART training ended, students were asked about their knowledge gained from, or first about the campus climate after, as a result of how HEART programming was impacting their college campuses. So it's worth noting that a lot of the students were very appreciative of HEART, and that it allowed for more discussion, beginning conversations about sexual violence on their campuses and engaging more Muslims on campus. But again, there's still this issue in that there's a lot of denial and hesitation coming from the Muslim communities on their campuses. And I want to emphasize this last quote specifically because it's concerning Muslim students and not being able to get the support that they need from their MSAs, from other Muslim students, and from spiritual leaders on their campuses. And that'll be something that we're still trying to unfold and how to combat that in later programming. And then finally, we asked them about their knowledge and skills gained from the workshops and the trainings. The first quote was very much, it sums up a lot of what other students were explaining, in that they were implementing a lot of the skills gained from HEART in terms of active listening, providing resources to survivors, and being consciously aware of how to respond to sexual violence on their campuses. But they also explained that these were universal skills that they were learning, and that they can use them in a lot of their interactions on a daily basis, not just with survivors. And then finally, one of the major trends found was the challenge for students to discuss sexual violence with their parents, with men, and especially male relatives. And I think that is something that we're still trying to unfold, and having more programming, targeting men specifically, and how to engage them better in those conversations.
So just, we have got 1 minute left, so we're just going to speed through the end here, but basically some of the challenges and limitations, they sort of asked for, the students sort of asked for more information on policies and laws, in terms of our delivery, more activities, maybe being a little more hands-on. Students wanted to learn more about the impact of Islamophobia and internalized Islamophobia in some of these conversations, because we had brought it up, but I don't, it seemed like it wasn't totally mapping on for a lot of the students.